Why does depression make me feel fearful, anxious, tired, and worried? In depression, it is both ideas and bodily reactions that peg the metabolism to a low level. The person will feel like they have a lack of energy, yet they may also have trouble sleeping, especially if their heart rate is high. In some cases, this can be relieved by exercise, because a change of scene may temporarily help lift the sadness enough so there is only the high energy state of fear. However, in the case of worry, and thus anxiety, there are serious effects. In doing exercise, the person may do damage to their heart. Fear causes several conditions. 1. Cognitive function is temporarily declined in favor of perception. The person cannot reason properly with the ideas. 2. They become attentive and focused on the source of the threat, which is the chief offender. Ideas are more easily suggested to them. There is also a freeze aspect to fear. Fear can cause the person to become slow and even unable to move, catatonia, passive movement, immobility, and stupor. In some animals, even motionless is seen, since playing dead is the strategy of survival. The same bodily reactivity can, to some degree, be seen in humans. The fear reaction in all cases is obvious from the issues being presented by the depressed person, and they indicate an abnormal depression. 1. Trouble falling asleep. 1. If the heart rate is even slightly higher than the resting metabolism, falling asleep becomes a problem. 1. Oversleeping can also indicate that the person's metabolism is too low and the heart rate is slow, as in the freeze aspect of fear. 1. Poor appetite. 1. Fear declines digestion. 1. However, both undereating and overeating can be the result of a coping habit. 2. 1. Feeling tired or having little energy. 1. This can be the result of the freeze aspect of fear, but also in anxiety where the heart has become ineffective as a pump. 1. Trouble concentrating. 1. Fear declines cognition. 1. Moving and speaking slowly. 1. This too is due to lowered metabolism consistent with the freeze aspect of fear. Solution. Recognize that the ideas are only the mental suggestions of someone related and inhumane and with an agenda, most commonly to manipulate and control or to punish you for some reason. Realize that the ideas are bogus. The ideas seem to be evidenced by the underlying bodily reactivity, because a higher heart rate is consistent, normally, with consent or agreement. But in reality, the ideas and the bodily reactivity are unrelated. This means how we feel, and what we seem to be thinking are not related. The ideas and the emotions are coincidental only. Like and subscribe for more videos.